Across the nation, healthcare systems continually battle chronic disease in an attempt to retain human well-being. However, the rise of chronic disease produces a set of challenges for the health industry. Today, the escalating chronic disease trend forms a major epidemic and leaves the local health systems asking important questions. What are common chronic diseases in the area? How do chronic diseases affect the patient? And what alterations and solutions could change the health epidemic's progression?
My current job, I've been at for 4 years, and I work for Owensboro Health in the wound care setting, so we see a lot of chronic diseases there. When I work, currently the main things I see is a lot of diabetes. That would be probably, in my current field, the most chronic disease that I see the most frequent. We deal with a lot of lymphedema, which is excessive swelling of the legs, and once they reach a certain maximum of pressure, it starts weeping outside the skin. We see a lot of heart disease that affects wound healing. We see a lot of stroke issues due to the limited mobility after stroke. Patients get lots of sores from pressure. The immobility of stroke is very deteriorating on all aspects of health.
According to the Centers for Disease Control and Prevention, more than 29 million U.S. adults have diabetes, and 25% of them don't know it. Meanwhile, every 42 seconds, someone in the United States has a heart attack, and every 4 minutes, someone dies of a stroke. The data expresses chronic diseases like diabetes and heart disease affect the nation, not just the tri-state area. If millions of U.S. adults suffer from chronic diseases, then how are patients affected, and what trends have healthcare professionals discovered regarding chronic disease?
I think it's a team effort. It's not just the patient's effort, and I explained this to my gentleman that just had on Friday. I explained it to his wife that it's just not his disease, it's a whole family's disease, and everybody has to participate in helping him succeed at controlling his diabetes, or he will continue to deteriorate. Them facilities all need to be state-of-the-art education, get the best practitioners out there, because clients and patients are living longer, and there's going to be needed more facilities that can take care of patients that have these chronic diseases, because people aren't dying as quick as they used to die.
Chronic diseases no longer affect only the patient. Instead of a patient handling the disease's symptoms alone, families and healthcare providers share the hardships and are impacted in various ways. In fact, chronic disease is a national health burden. The country faces a demand for medical practitioners, especially clinicians specialized in chronic disease. Other requirements, like extended long-term care facilities, cause stress among the healthcare system. Even though chronic disease negatively impacts our country, these diseases are treatable. By evaluating the causes of chronic disease, our nation can halt the epidemic's advancement and create solutions.
The biggest issue for me as a clinician is education. The lack of education. A lot of people get diagnosed and they're basically said, here's this pill or here's this shot. This is what you need to do. But it takes more than that to control. I think the providers need, which are primary care doctors, need to take a little more time at making sure the patients understand what they need to take, how they need to take it. A lot of times patients adjust their own meds without consulting a provider or a nurse about it.
The lack of education and understanding between doctors and their patients creates multiple problems within the nation's healthcare system. However, minimal changes to the healthcare operations could produce a paramount difference for chronic disease awareness. Since chronic diseases remain preventable, there is still hope the country could bring chronic disease to a halt. The current changes in chronic disease awareness forms an emphasis on health and generates hope to end the epidemic.
A lot of employers are encouraging exercise. They have programs at work where they challenge the employees to have better healthy lifestyle choices. Their insurances discounts are based on what these employers are doing and the employees do. They have Fitbit giveaways. They're promoting 5Ks. They're doing little health fair checks throughout the year on their employees. So I do feel like as a whole our community is promoting the community to make better choices.
Although more changes are necessary for the continued awareness of this epidemic, promoting 5Ks and health products like Fitbits acts as a starting point. Education, medical advancements, and professional expertise holds the key to conquer the nation's chronic disease epidemic.